Hi, thanks for tuning in to this very special event for Fibroids Awareness Month. My name is Candace Tingen. I'm the Program Officer overseeing the Uterine Fibroids portfolio for the National Institute of Child Health and Human Development, or NICHD. NICHD is joined today by Sateria Venable, CEO and founder of the Fibroid Foundation, Tanika Valbrun, founder of the White Dress Project, and Dr. Erica Marsh, Associate Professor of Obstetrics and Gynecology at the University of Michigan Medical School and Chief of the Division of Reproductive Endocrinology and Infertility. Dr. Marsh is also an NICHD and NIH grantee. During today's live event, we'll share some fibroid basics, answer some common questions, and introduce helpful resources for patients and health professionals. So we'll start with Dr. Marsh. Dr. Marsh, you'll lead us off by sharing some important fibroid facts. Welcome today.
Thank you. Really excited to be here, Dr. Tingen.
Thanks for being here. So let's start off with the very basics. What are fibroids and what are some common symptoms of them?
Basic question, but really important one, and one that not enough people in the public can answer. And so that's something we're going to have to work to change. But basically, fibroids are benign or non-cancerous tumors or masses in the wall of the uterus, or what we commonly call the womb. They are very prevalent, meaning more women have them than not, or more individuals with the uterus who are born with the uterus have them than not by the age of 50. And the reason why they are a key topic of discussion for today and for many of us every day is because of the symptoms that they cause. While it's true that about half of women or up to half of women with fibroids may not have symptoms at all related to their fibroids, that a good proportion of individuals who do have fibroids are symptomatic. And those symptoms are most commonly heavy menstrual bleeding, or what we call abnormal uterine bleeding. So very heavy menstrual periods that can often be prolonged. They also include very painful periods due to passing of clots, and again, the buildup of excess blood in the cavity. And also bulk symptoms, symptoms from the actual size of the fibroid that can press on the back, on the bladder, on the bowel, and cause symptoms like urinary frequency, feeling like you have to go to the bathroom very frequently, or constipation, feeling like you're having trouble moving your bowels. And again, that lower back pain that I mentioned, if you have a fibroid that's really pressing on the back side of your uterus.
Wow. So it sounds like you said that there was a large impact. There's possible pain, there's bleeding. What other impacts on women and their families are there from uterine fibroids?
The impact of fibroids really goes beyond the physical. We know that fibroids are associated with increased rates of depression, increased rates of anxiety. The symptoms of fibroids can be frightening not only for the patient, but also their loved ones. When partners or others in the household are seeing, blood-stained sheets, blood-stained mattresses, a lot of menstrual hygiene products being discarded, it can be very frightening. Again, not only for the patient that's experiencing these symptoms, but for those that care about the patient.
So, Dr. Marsh, it sounds like you said even having a uterus is a risk factor for this condition because it's so common. Are there other common risk factors for uterine fibroids?
That's a great question, Dr. Tingen. I would agree with you that the most substantial risk factor for getting fibroids is having a uterus, being born with a uterus. I would say the second most significant risk factor is age. We know that individuals in that reproductive window, typically 20s to 50s, are most commonly affected by fibroids. I think the third most significant risk factor is race. And the reality is that in our current literature, we've only done a deep dive racially with with individuals of European ancestry or whites and individuals of African ancestry or Blacks. And so we can't say a lot about the intersection of race and ethnicity amongst groups other than those two groups in fibroids. But we do know quite a bit about fibroids in our white and Black patients, and we know that African ancestry is a very significant risk factor for having fibroids. And whereas the overall prevalence of fibroids is in the 65 to 70% range when we look at individuals up through age 50. In patients of African ancestry, that prevalence or cumulative incidence, if you will, goes up to closer to 85, 89%. So a much higher prevalence in that ancestral group or that racial group.
Wow. So these are really, really common across ethnicities, across races, but even more so from those with African backgrounds.
Yes, I would say so. I mean, fibroids are a disease of the uterus. So anybody born with a uterus is at pretty significant risk of having fibroids. They may not be symptomatic from them, but they are very at significant risk. They are more likely than not to develop a fibroid by the age of 50. Having said that, if you are of African ancestry, then that prevalence, that cumulative incidence goes even higher. And we know more than that. We know that fibroids start earlier. They develop earlier. We see them developing in the early 20s versus the 30s. If you're of African ancestry versus European ancestry. We see individuals of African ancestry having more fibroids, having larger fibroids, having more symptomatic fibroids.
We know that you are treating fibroids every day in the clinic for your patients. How are some ways that fibroids are treated?
A lot of that is we can talk about the different categories of treatment, Dr. Tingen, but I want to start by saying that a lot of the treatment decision really comes down to what the patient wants, what their goals are, what their desires are. So I know what my formal training guides me or leads me to recommend for a given patient, and a given set of symptoms. But at the end of the day, it's my responsibility to make sure I understand what that individual standing in front of me is open to. Now, treatment options for fibroids can range from what I call conservative treatment or observation. And we do that most commonly when patients have no symptoms, or if they do have symptoms and they've been counseled about all of their options and the risk and benefits, and they decide, Dr. Marsh, I understand, I don't want anything done right now, okay? Because it is a patient's right to make that decision. In those situations, we work hard to come up with a plan to monitor the patient, to follow their symptoms, and if labs and imaging are appropriate, to do that over time as well. Another broad category of treatment is medical treatment. So there are different types of medications we can offer depending on what the patient's primary symptoms are. There's some that are targeted toward the pain that's associated with fibroids. There are some that are associated with the bleeding and some that are associated with the size. The last two categories are surgical interventions, so removing the fibroid surgically or removing the entire uterus surgically. We call the former myomectomy and the latter hysterectomy. And then there's procedures that the interventional radiologist can perform, most commonly procedures called the uterine artery embolization, as well as MRI guided focused ultrasound. So all of those treatments have different, are for different symptoms, and are, the best treatment plan for you as a patient is going to be unique, just as you are unique.
Fantastic. Thank you so much. I think that's an important message for people to hear. So thank you for that information. We're actually going to hear now from Sateria and Tanika, who are going to speak to us a little bit more about what life is actually like for women living with uterine fibroids. Welcome, Sateria and Tanika. Sateria, we'll start with you.
As a fibroid patient, I think it's important to note that many people you probably know, work with, or related to have suffered with uterine fibroids. And it may not be vocalized because there's still a significant stigma around conversing on menstrual issues. But some of the symptoms typically are, as Dr. Marsh mentioned, heavy menstrual bleeding, passing large clots, there's fatigue. You may be experiencing shortness of breath, as I did. And I had learned from having really tough periods from a young age to just kind of suffer through the symptoms. And I endured them from the start of menstruation at 11 into my mid-20s, and until the bleeding got too heavy for even me to manage on a day-to-day basis. And it can just be completely overwhelming, because when you are afraid to have an embarrassing moment in public, you restrict your activity. So it is life altering. And it's important to note that many menstruators are going through life working every day in pain, as I did, working very demanding jobs in pain. They may not have the luxury of taking off from work.
Right.
And it's much more prevalent than I think many people realize. So I'm so happy that we're having this conversation today.
Thank you. If there was one thing that you could tell someone living with fibroids, what would it be?
To take care of yourself, make yourself a priority, and educate yourself on treatment options so that you can address the symptoms early.
Thank you. Tanika?
Thank you so much for having me. I'm really proud always to join both of these ladies and you, Candace, to ensure that we're sharing our story and getting the message out there as much as we can to educate the public. As Dr. Marsh alluded to, fibroids really encompasses the whole person. It's really a psychological, physical, it impacts your career, how you interact socially. And that's really how it impacted my life. Very similar to Sateria, my fibroid symptoms started very early at around age 14. And I have always known myself to have very, very heavy periods, clotting, abdominal pain. I was always that girl on the road trips that we have to stop at the rest stop for Tanika because she has to use the bathroom. So that was my life. And I just thought for a very, very long time that this was a woman's journey. This is what it was like to have your period. And my mom had fibroids. And she told me, about her hysterectomy after I was born, obviously. She lost a set of twins to fibroids. Wow. But even when I was having these symptoms, we were still like, oh no, there's no way. There's no way that this is fibroids. So it really, and I should say, when I think about how much she taught me about fibroids, she really taught me how to protect myself. So she taught me, this is how you wear it, 2 pads at a time. I never knew what really tampons were because that's not my life. I used to always say, who are these women who wear tampons? Because the flow is just too heavy. Like, how is that being managed with tampons? She taught me when to take my ibuprofen in time, to how to protect myself, basically. So when I think about the impact, it really, like I said, is the impact on the whole woman. and really goes to so many areas of our life. So it's important that we have these educational conversations so that women can recognize what are the symptoms, what am I experiencing, and we really eliminate normalizing these chronic illnesses.
Right. Thank you so much. I think that's such an important point, that knowing what is normal for you and what should be normal is really important here. So I want to thank you both so much for telling your story and helping us raise awareness of what it really is like to live with this condition. You are both heading up wonderful organizations, though, that help women and provide a lot of resources. Could you give us an idea of what kind of resources your organizations provide? And Tanika, we'll start with you and the White Dress Project.
Yeah, absolutely. So the White Dress Project is a nonprofit organization dedicated to raising awareness of uterine fibroids and supporting communities everywhere so that people who are managing life with fibroids understand that they don't have to suffer in silence. One of our biggest missions is to ensure that we are encouraging those with fibroids to make sure that they are their own best health advocate. Everyone cannot have a Dr. Marsh in their life, right? Every physician, unfortunately, is not like her and really puts the patient first. So if you don't encounter someone like her, then it is important that you are your own best health advocate. And what does that mean? That means journaling what is happening in your body, taking care of yourself through your diet and exercise, and making sure that the changes that you see in your body, that you can articulate those to your doctor. I always say also that, you should bring a friend with you to the doctor if you can, and encourage your tribe to come along, because a lot of times when we're hearing these diagnoses, we are, what pharmacy, what pills should I take? All of the things, it becomes extremely overwhelming. So a lot of times having somebody there with us helps with that. In terms of resources, we are a patient support group. We partner with government agencies, we partner with consumer brands, anywhere that we can to get the message across, hospital groups, physicians, anywhere we can to ensure that women are hearing that they have options and that they have support. So we do a lot of this on social media. One of the things I'm most proud about is our authoring the legislation to get July declared as Fibroid Awareness Month. That was monumental for us. Another program that we have started is called White Dress Cares. And that program is, think of your old school peer-to-peer mentorship. So for example, if Sateria is in a part of her journey that she has gone through multiple surgeries, and we can pair her with someone who is just starting out their surgery journey or trying to make a decision. So just having that peer-to-peer consult is just something additional that you can have, that you can also have along with your physician's guidance, obviously. So yeah, we offer quite a bit of resources. We have a great advisory council, and really just offering educational programming so that we can ensure that people understand that they don't have to suffer in silence.
Fantastic. Thank you. I think that community is so important. Sateria, do you want to tell us a little bit more about the Fibroid Foundation and the resources that you provide?
Sure, and that was a great overview that Tanika gave. We too really focus on the patient. And I think one of the pivotal things that we try to provide is support when trying to find resources in terms of care, because I really don't want anyone to have to go through what I went through, especially when our community is having difficulty finding someone to treat their specific symptoms, as Dr. Marsh spoke about, and that when we know of a provider who could easily treat that person. And so we try to be very cognizant of physician resources and minimally invasive gynecologic surgeons in certain cities and pair them with the patient there. We also pair them with peer-to-peer counseling and help to provide hopefully that comforting, warming space where folks really feel comfortable talking about what they're going through and finding the day-to-day support that they need. And we do that through fibroid talks, where we try to create an environment where a patient and physicians can all mingle in a social setting, which is unusual for the two of them to come together in that setting, but to be able to dialogue casually, to be able to take that pressure off of the office visit, the typical office visit, because not everyone has access to a Dr. Marsh. And so we try to create that environment. We also hosted a Fibroid Summit, which is now an annual event where we do a forward-looking overview of fibroid research, and then have patients actually provide questions at length for the physicians who've presented their research. And that's been really important in uncovering the patient voice. I think that's really where we try to anchor our advocacy efforts. I've learned over time through the research that we've designed and the research teams that we've had the honor of participating on, that the patient has a unique voice, and every woman's an expert in her own body. And when the patient voice is paired with the physician expertise, that's really the ideal situation for one-on-one counseling in a physician's office or for a large research project. And we also carry that patient voice over to device development, medical therapy development, and also through advocating for more research funding. So those are just some of the ways that we try to reach the community through our chapters, make sure that women are not delaying their symptoms, and that we're all seeking the treatment that we need to be our best selves. And there are platforms and conversations like this one that I'm particularly grateful for, where we can have a conversation about the emotional impact, which is enormous. And that was something that I did not have access to. I thought I was alone in my journey, and there are significant emotional pressures that take place in terms of relationships, job pressure, moving around in society. And it's not just something that's impacting the individual, as we've all mentioned. I think we can't overemphasize the fact that this is a societal impact
Right.
on the millions of people affected.
Thank you. Thank you both for telling us a little bit more about what's available. I think that's probably very comforting for, people to not have to go through that isolation that you had to go through. And I think that we'll be linking to the White Dress Project and to the Fibroid Foundation in this video. We'll also provide links to the NICHD educational resources that tell more about fibroids from the scientific perspective as well, and some of the science that we're doing there. Before we wrap up, Dr. Marsh, I would just want to ask you just a few frequently asked questions. I think you've touched on these, but what is that very first step? If I think I have fibroids, what should I do?
Another great question, Dr. Tingen, and an important one. Thinking you have fibroids and having fibroids are two different things. So you do want clarification around that. I would encourage you to go to one of your trusted healthcare providers, an OBGYN, or your primary care doc, particularly if they have a focus on women's health and women's care. Often fibroids can be initially screened as part of a bimanual exam, which most individuals who have a uterus and a vagina are screened for or screened with annually as part of their annual exam. Sometimes an ultrasound can be very helpful in diagnosing fibroids. If there's not, if there's not a high suspicion after the bimanual exam. But the main thing is to reach out to a trusted healthcare provider in that first step and say, hey, I think I have fibroids, and this is why I think that. And I'd like you to reassure me one way or the other. Either, let me know that I don't have them, or let me know that I do have them, and what the next steps look like.
Fantastic. And I know we've talked about treatment, but I do want to reiterate here, because I think this is a fear for people who have fibroids. If they have them, if they're symptomatic and they're problematic, is a hysterectomy going to be the only solution, or are there other options that people could try?
Yeah, absolutely not. And I want to be careful not to demonize hysterectomies. I think that for some patients, hysterectomy is the appropriate treatment. It is a life-changing treatment. For some patients, hysterectomy is absolutely not the right treatment, and patients should not feel forced or pressured into having a hysterectomy. I will say that hysterectomy, again, just to review for everyone, is a surgical procedure where we remove the uterus or the womb of the uterus, the womb. And after we do that, an individual is unable to carry a pregnancy. It's a permanent procedure, so we can't undo it once it's done. But it's also the only definitive treatment we have to say, you are never going to have uterine fibroids again. Having said that, if you don't want a hysterectomy, you don't want a hysterectomy. Okay. So some people don't want a hysterectomy because they want to carry a pregnancy. Some people don't want a hysterectomy because they just want to keep their uterus. It's theirs and they want to keep it. Right. Some people don't want a hysterectomy because they don't want surgery of any kind. They have concerns about surgery. They have fears about surgery. And I think so the short answer to your question is, if you have symptomatic fibroids, hysterectomy may be an option, an option for you, but it is certainly not the only one. And it may not be an appropriate option for you, again, if you want an intervention that's going to allow you to keep your uterus, allow you to carry pregnancies, allow you to avoid surgery. And I think we have fewer therapeutic interventions than I think we should have for this disease, but we have more now than we have ever had for this disease. So I think that there are, we have more medical interventions than we've ever had. We have radiological interventions now that are relatively new, in the last 10, 15 years on the market. So I think, there is a nice set of options for all patients. And I think the key things are really understanding what your personal goals, hopes, desires, fears are as a patient, and then finding that trusted healthcare provider that's going to be able to walk you through the options, tell you about their risk and benefits, because everything has a risk and a benefit, whether it's a hysterectomy or getting a hangnail removed. Every procedure has a risk and a benefit, and making sure you understand the risk and benefits, that you're comfortable, and that you select a treatment that you're comfortable with that risk benefit profile.
Fantastic. That was excellent points made, Dr. Marsh. As you know, as we all know, it's a very interesting time right now with the pandemic. And I'm sure that people are wondering if there's any considerations from COVID on their fibroid care, on how they should think about that.
Yeah, again, great question, Dr. Tingen. I think this is not a condition that you should feel like you can just delay until after the pandemic is over. We don't know when the pandemic will truly be over. And so it's important that you seek care now, that you realize how important you are as a patient, and that you get the care that you need, even if it's temporizing care, even if it's short-term care, but there's no reason for anyone to be suffering in silence from fibroids.
Fantastic. That's a great point to end on. Thank you so much, Dr. Marsh.
Thank you, Dr. Tingen.
Thank you all for joining us today. That's it for us. I want to thank all the speakers for being here. If you are watching and you want to learn more about living with uterine fibroids, as well as promising research being done at NICHD, be sure to visit the links that you'll find here to NICHD, the Fibroid Foundation, and the White Dress Project websites. Thanks again, and take care.